Talk about the business impact. Is Obamacare an economic growth and job destroyer, or maybe not? Here now to talk about the potential burden businesses face, we have Business Roundtable President and former Michigan Governor John Engler, and Sharp Details CEO and author of The Practical Guide to Exceptional Living, Jim Garland. I want to go to Jim Garland. Jim, we have not yet met. Welcome to the Cutler Report. What happens to your business? You've got a small business. I think you employ 70 people. What happens now that Obamacare is going through?
Well, you know, that's what we're faced with. We're faced with uncertainty. We're not sure what's going to happen. I'm sure my costs are going to go up. But, you know, none of this kicks in until 2014. And when that happens, our costs are going to go up. We just don't know how much. So lots of uncertainty right now is the problem we face.
John Engler, for big companies like the Business Roundtable that you represent, this one-size-all insurance plan is also going to be very expensive for certain categories of workers. Isn't that why a lot of your members got waivers for this? But you can't get a waiver every day. So how upset are they?
Well, Larry, I think Howard Dean in the earlier segment touched on the important point. This law doesn't fix the cost containment problem. We've still got a problem in health care costing an awful lot in America, and it is a challenge for companies. It's a challenge when you look at payroll. Too many workers have had to forego wage increases because all the compensation has gone into the health package. When we look at the budget of the United States, the change that we need in the entitlement systems, Medicare, even Medicaid, are driven by health care costs. So much work to be done. If you want to repeal and replace, you've still got to have a plan. If you support and love Obamacare, you still got to fix the law. So the debate's just beginning.
Right, this whole thing. Jim Garland, what's it take? My impression is the cost of hiring the extra worker with Obamacare insurance is quite substantial, enough to make you not hire the extra worker.
That could be a possible effect of this. I mean, you know, our costs have been going up about 25% over the last 3 years. But again, it comes back to uncertainty. If we're going to have to kick in and help pay for a lot of these employees that are going to be mandated to cover health care, you know, that cost for every employee has just now gone up maybe 15 or 20% more than what it is today.
All right, I got to leave it there.
And that's going to cause issues.
I'll just say, gentlemen, both of your taxes, including my taxes, are going to go up. Payroll taxes, investment taxes. Don't forget all that. I'm sorry we don't have more time. John Engler, thank you. Jim Garland, thank you.